Okay, perfect. Good afternoon, everyone, and welcome to this webinar, Leadership in Crisis. My name is Lubna Araji, and I'm the Director of Executive and Professional Education at Rutgers School of Management and Labor Relations. And it's our pleasure today to co-host with Competitive Business Solutions distinguished industry executives as they share and compare their strategies for navigating today's challenges. Our panelists will share perspectives that stem from navigating the 9/11 economic impact back in 2001, as well as the economic crisis of 2008. And they will be discussing topics like employee communication, leadership challenges, financial adjustments, staffing, and dealing with operational issues. Today's webinar is a panel discussion that's scheduled for 60 minutes. All participants are muted. So please, if you have a question, make sure to submit it via the WebEx questions box at any time. To share your questions or comments using the chat or Q&A with everyone in the audience, make sure to direct them to all participants. This webinar is being recorded and we will be sending a link to everyone via email. It's my pleasure to introduce our moderator and collaborator, Ed Hoffman. Ed is president and founder of Competitive Business Solutions. Ed is also a graduate from Rutgers, from the School of Engineering and the MBA program. Prior to launching his company 20 years ago, he was in different roles such as manager and director at GE and Lockheed Martin. His company now has over 60 core team members who are delivering their services in 48 states and 9 countries. And they provide support to multiple industries, including aerospace, healthcare, food and beverage, government, etc., in operational excellence, mergers and acquisitions, leadership and change management, supply chain, and program and project management. It's a pleasure to have you, Ed, and have our panelists. And please take it from here.
Lubna, thank you very much for the introduction. Once again, my name is Ed Hoffman, and I'll be the moderator for today's panel discussion. What I'd like to do is just provide a quick overview of the format before we get started. The format's going to be a question and answer style panel discussion. I will ask about 20 to 30 minutes worth of questions. And while that's happening, we're asking you, the audience, to put questions to the panelists. We have a chat box that's open for you. We ask that you put your questions into that chat, and we'll sift through those, and I will ask those at the bottom of the hour and again near the end of the discussion. We will then do a short wrap-up. We look to finish up, as Lubna mentioned, before the top of the hour. What I'd like to do is introduce the panelists at this point. Our first panelist is Amy Mansu. Amy was recently announced as the president and CEO of Inspira Health, starting on September 1. Currently, Amy is the executive vice president and chief experience officer for RWJ Barnabas Health, which includes 11 acute care hospitals and manages the care of over 5 million people. RWJ Barnabas Health is the state's largest private employer with over 45,000 employees. Amy has extensive experience in business and government. Amy was co-chair of Governor Phil Murphy's Budget Transition Advisory Committee, chair of New Jersey Chamber of Commerce, and chair of New Jersey's Hospital Association. In prior administrations, Amy served as the deputy chief of staff to Governor James McGreevey and a staff member on healthcare policy for Governor Jim Florio. Amy is frequently honored and has been named New Jersey Business as one of the top 50 most powerful people in healthcare, one of the 100 most powerful people in New Jersey business, and one of the top 50 women in business. She's been recognized for nonprofit organizations for her work on healthcare reform and for people with disabilities. Amy is a member of Rutgers University Board of Trustees. Amy, it's a pleasure having you on our panel. Our next panelist is Sunita Holser. Sunita is the Executive Vice President and Chief Human Resource Officer for Realogy. Realogy is the leading U.S. residential real estate service company with franchise, brokerage, title and settlement businesses, as well as a mortgage joint venture. You would recognize many of their brands. They include Better Homes and Gardens Real Estate, Century 21, Coldwell Banker Commercial, Corcoran Group, ERA, and Sotheby's International Realty. In this role, Sunita is responsible for all aspects of Realogy's worldwide human resource strategy and implementation for over 10,700 employees. Previously, Sunita served in similar roles for Computer Science Corporation, Chubb Insurance, GE Capital, American Express, and American International Group. In addition to Sunita's executive role, she has served as a member of the Board of Directors for South Jersey Industries and serves on the advisory board for the Human Resource Management Department at the Rutgers School of Management and Labor Relations, and on the Program Advisory Committee to Regender, a nonprofit women's research organization. Sunita speaks and writes regularly about human resource management and leadership issues, and is the author of Wednesday's Wisdom, a weekly LinkedIn blog. Please welcome Sunita to our panel today. And our final panelist I'd like to introduce is Mike Gass. Prior to retirement, Mike was the president and CEO of United Launch Alliance, also known as ULA. ULA is a joint venture between Lockheed Martin and Boeing Company to build and launch heavy lift vehicles to support space station and other NASA and government projects. Mike's leadership was instrumental in the development of the joint venture, as well as leading the first 8 years of ULA's existence. Before joining ULA, Mike served as Vice President and General Manager of Space Transportation for Lockheed Martin and manager of numerous launch vehicle programs. Mike's been very active during his retirement. He serves on Colorado's Governor's John Hickenlooper's Educational Leadership Council and co-chaired former Colorado Governor Bill Ritter's P20 Education Commission that works with groups to improve the state's educational system. He's volunteered for a number of nonprofits, including Denver Rescue Mission, Mile High United Way, and Project Cure, among many others. Mike is currently on the board for XCOR Corporation and the Space Foundation, a nonprofit that promotes international space activities. He's also co-chair of Metro Denver Economic Development Corporation's Colorado's Aerospace Coalition. Please welcome Mike Gass to our panel. I'm going to go into the Q&A at this point. What I'd like to do is pose the initial question. It's going to be posed to all three panelists, and then we will do some follow-up questions and continue on through the Q&A. I see that we have our PowerPoint still being presented. We might want to bring that down so the panelists will show. Thank you. So I'm going to pose the first question to Amy, and then we'll move over to Mike and Sunita. Amy, please share your leadership experience and roles during the post-9/11 crisis and the economic crisis of 2008 and of today. Do you see any similarities on how the crisis is being managed and what your role has been in that?
Yeah, Ed, in 9/11, I did not have a leadership role that would have had that level of influence as I did in 2008, and obviously in the most recent downturn that we're experiencing now, the pandemic. In 2008, I was the president of Children's Specialized Hospital, which is the largest pediatric rehab hospital in the country. And we had just moved our facility to New Brunswick and embarked upon an entirely new inpatient footprint. So we'd gone through a bond deal. We had all of these great plans. We had lots of expansion, and then all of a sudden, here you are, right? And you've got to, we looked like rocket scientists. Mike, no disrespect intended, but we looked like rocket scientists because we had locked in our rate, and everybody told us we were crazy. We should go to a variable rate. So we were protected on that side. But we knew that there was no way that our growth was actually going to be able to calibrate. And so we did some of the things as I've listened and learned about my colleagues on the panel. that they do as a normal course of their business. So we brought in folks that helped us with an Operation Excellence program, looked at really trying to tackle some of those, what I'd call third rail issues that you didn't really deal with. You just sort of limped along, looking at really streamlining healthcare. And that's obviously something we continue to work on to this day. We slowed down our capital projects, and really began a deep dive on what were the items that we could evaluate and try and limit the losses, because often in healthcare there are things that you have to take a loss on in order to generate a revenue through another vehicle to drive the patient volumes. So all those three things happened in 2008. As we look at what we've gone through in this pandemic, I would tell you that just the rapid rate of change has been unnerving for staff and for leaders, and especially for leaders, even more so than staff, because we have playbooks that we work with every time to be able to accommodate. But this pandemic has no playbook. And literally, as we were trying to implement rules, the rules were changing both at the federal and state level. In this role, I had two different hats. One was I was executive vice president at RWJ for the patient experience, but also given my time in government and my relationships with the Department of Health, I served as the central region role to be able to organize the hospitals throughout half of the state. And in that role, it really required constant communication, constant boots on the ground to be able to give feedback on what we were seeing, because the disease literally and the virus was transmitting so quickly. And there were a couple of other resources that I did not necessarily appreciate until that I had them at my ready. And one was using some of the national organizations where we could share best practices through chief experience officers of what happened in Washington and in Seattle, where they got really hit first. And that led us to really learn from some of those things and apply them real time. And you would ask me what those are. So as an example, as soon as they shut down visitation for families, which is just devastating for somebody who has a family member in the hospital, as you can imagine, that responsibility to provide that link, if you will, to the family of both communication and just the basics of how their loved one was doing fell to a nursing staff and a physician staff that was already completely stretched by the virus. So really trying to think about those creative ways to use technology to have different roles of people coming in, so their outpatient volume shrunk to zero, having those people then come in and serve some of those roles. And then lastly, I would say the partnership with the state. The Commissioner of Health was very clear with us at all hospitals that we would need to double the capacity of our ICUs. And basically, as we looked at the predictive models, every hospital bed in the state would need to have to be staffed with people who were able to handle the highest level of acuity in an ICU bed. And that meant real time taking people who were on a med surg floor, or candidly, some nurses that had not been on the floor for years, and literally training them, retraining them. And so in essence, what you would do is you took the med surg nurse and you trained them up to the ICU nurse, and those nurses who had been an outpatient, you trained to go into med surg. And it was just a constant pressure of trying to meet that. And so at the key of all of this was communication and a lot of apology for when the words would change and people were struggling. And then lastly, I would say to you, obviously what all of us are dealing with right now is access to supplies, and that crunch on our supply chain was not like anything we've ever felt, and still continues even after we've been able to settle down, continues to be the thing that keeps us all up at night.
Thank you. I think we're going to come back to communication and supply chain again as we go through, because I think that's going to be a theme throughout this discussion. Thank you very much, Amy. I'd like to pose the similar question to Mike as well about during the leadership crisis of 2008, how did that impact the business you were working in? What were some of the key actions you took, as Amy described in her business, to maneuver during that time?
Thank you, Ed. First, let me say hello from Colorado. And me as my career from United Launch Alliance, but I started as General Dynamics, Martin Marietta, Lockheed Martin, United Launch Alliance, and never really changed jobs. I was 36 years of continuous services, but companies changed names. But my career in aerospace was pretty consistent. This topic is about leadership in crisis, but you could also just say leadership in major change. A crisis is a stimulus for the kind of change. My first experience of leading change was in mid-90s when it was with General Dynamics. We got sold to Martin Marietta and then became Lockheed Martin, all within 13 months. And the change that was going on was dramatic. I was in a plant of 25,000 people, and that plant doesn't exist anymore. And I was the last executive at that facility, so I had the job of finishing up the production and closing it down. The lessons learned from all of that was many, and I used it throughout my career and applied it in my ULA leadership as CEO. But they posed a question about 2001, and the lessons were common. And throughout our discussion today, I'm going to mention things that start with the topic is crisis and change, but the leadership skills is about communication, competence, compassion, competency, conviction. So the opportunity was to basically take a plant that had 10,000 people and go to zero in a couple of years while still building, including rockets that you see over my shoulder. We were on schedule with all our commitments, and did it financially better than we ever expected. And it was treating people with respect, with compassion. And one of the lessons we had with that was to keep people informed where they stood. Some people were going to relocate. Some people were going to get laid off. The most important that you have in a time of crisis is let people know where they stand. Had a very detailed plan and schedule, and let everybody know where they were last day, and then they could work to it with compassion. That we helped them find new jobs, helped them with any other, have decent retention. But it was that communication of where they stood. One of the other things we did was not be sad about it. Held a barbecue every 2 weeks, and that was it was tied to the day we were going to let people go, and we celebrated those people's careers. We had luncheon, and after that, those people had to go for checkout from the facility. Several of those people wanted to come back and finish up their job. They were already checked out, but we wanted to show that we appreciated them and managed with clear conviction. So let me stop there, and we'll talk more about some of the other experiences.
I appreciate that, Mike. So my takeaway was Sunita, let me pose kind of the same question, maybe with a slightly different shape to it. So you managed over a different period of time as well. What were some of the things that you did during these times of crisis as a leader? You have a very significant HR responsibility. So as Mike was talking about how they were treating people, and if I were to rephrase kind of how Mike put it, with communication, honesty, and compassion, as they were dealing with some significant restructuring and plant downsizing. in real estate, of course, you have over 10,700 people. So during this time of crisis or others that you've dealt with, what were some of the strategies that you used within the HR community to deal with some of the challenges that you had?
Sure, thanks, Ed. I just stepped back as I was thinking about this question in 2001 and 2008, post 9/11, and then post the financial crisis. The big differences, I think, when you compare the crisis we're in today and those crises, was really the magnitude of the crisis and how many people it affected. So 9/11, those of us who lived here, or I worked in New York, it felt very dramatic. And there was a lot that we had to do around emotional well-being of employees, employee assistance programs and stress management programs, and so on, and dealing a lot with people's fear and concern. But that wasn't what was going on all around the country. That was going on around in certain pockets of the country. So it was a national crisis, but it wasn't affecting everyone the same. And then you go to 2008 and look at the financial crisis. Yeah, that was a big crisis, really affecting individuals who had homes and individuals, with their personal finances, especially those who worked in financial services. And then all the ancillary services around financial services. But again, it didn't affect every single person. It was an economic crisis. 9/11 was more of a national, it's a national well-being crisis, right? And here we are with this. And the biggest thing right now is it's not just one crisis, right? It's multiple crises. So it is the emotional stress around our health. So it's a health crisis. It's the crisis around our economic well-being and, whether we're going to have a job tomorrow or not. And then it's all the social unrest and political. So all three together make this a very dramatically different environment. And as leaders, the approach has to be very different. Absolutely communication and empathy, but also transparency. Early on, telling employees exactly what you know. And a lot of it was, we don't know. We don't know. We don't know if we're going to open our offices. We don't know if you're going to have to wear a mask. We don't know. And that's not a comfortable position for a leader because you're looked upon to have the answers. And by the way, in addition to the 11,000 employees, we have 300,000 sales associates. Those are the people who actually sell homes. So that's the gig economy. They're all looking for direction too, because they don't really have any one organization except for our organization. So the biggest things for us early on, and very different than the other two crises, was all of the ways in which we communicated. Dramatic communication, daily communication, 2 or 3 times a week, meetings with our executive committee, daily memos to our employees, lots of tools and resources for our employees, lots of support around stress management and guidance, lots of change management work. Doing that early on, really, really big, much bigger than we ever did before. Even having a meeting to say, I don't have anything to tell you, but I'm here if you have questions. And we kept doing that. I'll stop there.
No, that's great. That's great input. I want to follow up on the very last comment you made, which was, even if we didn't have something to say, we had meetings anyway. Why did you do that? Why did you think that was important?
To touch our employees in whichever way we could. These were all virtual meetings. By now, we were all working at home. We immediately sent everyone home. Unlike healthcare, we didn't need to have essential services. We had some essential jobs, but the majority of our employees work from home. We felt it was really important to help our employees with that transition and to make ourselves available. So even if we had nothing to say, we had the calls, we allowed access to the leaders, and we cascaded those around the organization. And surprisingly, there was a lot to say from what employees asked us. And they asked us the same questions over and over again. They needed to hear the answers over and over again.
Okay, great. Thank you. I'd like to come back to one of the things that Amy was discussing. Amy, you went through kind of the initial sort of, here's the 3 points of different things that affected us. And I kind of want to stay on the communication theme because you mentioned communication as well. Can you go through maybe some of the different strategies that you were employing at or are employing at RWJ? Are any of those strategies something that you've learned from previous roles? And are there any changes you would make now that you've kind of gone through this first wave of crisis in New Jersey?
Sure, Ed. I think I'll start with the 2008 comparative, if you will. There I was a hospital CEO, single hospital, and I very much had the belief of management by walking around. You needed to earn people's trust. You needed to show them that you'd roll up the sleeves. There was nothing that you wouldn't do that you've asked them to do, and it was really a one-on-one process. It was those that meant around the clock shifts. That meant being there when they were there. It meant coming in on the weekends. It meant many of those things that were different for most executives, but that were essential for people to be able, as Sunita said, to ask those questions. And even though you've answered them, answer them 7 times, 7 times 7, whatever it takes in order to make sure that they feel A, that they've been heard, and B, most importantly, that they're part of whatever solutions. I would say, if I fast forward, the difference is twofold. One, my position is a corporate position, and corporate position is sort of like government. We're here to help, but nobody actually really believes that. And so, trying to deal with that dynamics of not getting in the way of the work, and trying to anticipate what the next series of needs of those individual hospital leaders will be. At the same time, we had an entire outpatient structure that was crippled, that literally stopped dead, did not take any more patients. And so you were trying to get those people back to work, trying to redeploy them. I mean, all of that required a just continual communication. And I would say that technology that allowed us to do that. So we were texting, we were making sure that we were sending emails home to people. We were making sure that we had leaders touching people whose staff had gotten sick. Again, different from HR, because usually you give them the distance, you worry about HIPAA, can I know about what's going on? But this one, we knew that based on how the virus works, that isolation of being quarantined can just be devastating to employees. And I think we didn't fully understand. That was a later addition that we added on. Mike used the language, that compassion, never forgetting that in the middle of all of this work that we're doing, these people have real lives. So our staff, who were the first people to run into fire, were literally having to think about, am I coming home and risking the lives of my family by doing this? And so we they the opportunity to do that. It's much important for them to have that peace of mind that they could, even if they didn't. And I think for the employer, you can't always look at whether or not the success is in the numbers of people that do it, but that in the comfort that you're giving them by providing those extra services. Sunita mentioned the employee assistance programs. Yes, we certainly beefed up the mental health programs, but we also know that healthcare employees sometimes want things that are separate and apart from the organization. So we, during the sort of worst of the pandemic, we took the experience by looking at natural disasters and saw that there would be a period of time after this heroism that people would fall quickly with a disillusionment. So what were the programs that we could put in place in addition to our already robust employee assistance program to give people access? And so there we went to our nonprofit partners and set up things for kids to do chatting, who are dependents of our employees, so they could have a coach, being able to do telemedicine, telehealth online through a separate able to, which has been a wonderful resource. And then, going to some of our community partners, Good Grief as an example, which is a system that provides support for children who have lost immediate family members, and saying to them, look, our employees have seen so much death. I'll never forget the 40-year nurse who said to me, I have seen more death in this 30-day period than I've been done in my entire 40 years of nursing. Just being that only person to say goodbye to after another is why we also felt like we needed to give them an additional grief support, if you will, because they lost their patients. And unlike the normal where you have time to build relationships with families and help people adjust to this was happening so rapidly. And the employees were carrying that and still do. And so I would say, we were building those things. One of the most important things that we've done as we've gotten to the new normal of always having some COVID patients as the house, is we've done a hot wash where we just have gone through and said, everybody in the organization, all 35,000 people, tell us what we could have. And we've collated that information, and we're taking all of that data and putting it into a resurgent plan. And each hospital is developing their resurgence plan to address the individual things that came out of their facilities. Obviously, some of them are universal, but I think that level of transparency that both Sunita and Mike talked about is critical, critical, critical as we move forward for the country as well as for employers.
Thank you. Thank you. That's great input. Hot wash is something that many of us in leadership have gotten used to, particularly in times of crisis. And that's the idea of, Bethany, maybe you can mute the panelists and see if that cleans this up a little bit. Hot wash is the idea of taking a look at what happened and getting feedback so that you can improve the processes going forward. And that's really important. We're at the bottom of the hour, and what I'd like to do is look at some of the questions that have come in. Everyone is on mute, so as I pose the question to you, please take your feed off of mute so we can hear you. The first one is targeted towards Sunita. The question is, what is the biggest challenge with COVID-19 communications to employees?
Yeah, the biggest challenge is that you can't really give them the certainty they want. They want to know when they can get back to work. They want to know when they're going to get a vaccine. They want to know when they can go back to the way it was. And we have no way of ensuring that to them. We have no way of answering that question. All we can do is, in the next couple of months, it's going to look like this, and then it's going to look like that, and we don't know. And, you know, employees are dealing with a lot of fear, so that is the biggest challenge.
Great, thank you. I'm going to pose this question to Amy because this one came in from somebody who's working in an essential company or essential services, which means their company does not shut down. And so the question is, in an essential company, no shutdown, we haven't missed a day. Any suggestions on how to leverage this to boost employee morale, retention after this is over? And then maybe, Amy, after you're done with this, I'd like to throw that, because it's such an important question, to Sunita as well as Mike.
Yeah, I guess I would say two things. One, this might be the Jersey girl part of me, but I've got a level of skepticism about when this is over, right? So I think we need to really set some expectations because of two reasons. One, in a perfect world, we're not going to get the vaccine right the first time. Secondly, getting everybody vaccinated. We've been trying that with the flu and a whole bunch of different vaccines, and that is not an easy process. And then lastly, and probably most importantly, we need to pace ourselves. We are in a marathon. We are not in a sprint. And helping employees actually take the time they need to rejuvenate, even as essential employees, we force people to take time off, and, we'd get into the argument with them. Well, there's no place to go. What am I going to do? Well, I want to save my time, blah, blah, blah. It's like, you are spent, guys. Like, you are going to crumble. And so we had crucial conversations where we really were pushing the envelope to make sure they understood just how concerned we are about them. I would say that one of the most important things we did is that we contracted with agency nurses to come in and support our teams because they were beat, and we needed to be able to backfill those folks, train them up, and have them there just to relieve our staff. And so as you think about boosting morale, part of this is owning the stuff that we didn't do well right up front. The hot wash gives you a perfect opportunity for them to tell you real clearly what you didn't do, and they're really very transparent about that. But you got to own it. You got to tell people, look, we did the best we can, and that may not have been enough, and we're going to keep doing the best we can because that's what we expect of you, and that's what you expect of us. And that partnership with an employee, I think, is really, really critical in all of this.
Thank you. Let's, Mike, do you have some comments you would like to make on how to boost morale during these kind of crisis or change management, as you described it earlier, challenges?
Yeah, from experience I had in 2001 to something that I've recommended to the CEO of the company that I'm currently on the board of, which is Virgin Orbit, is more about transparency. I think Sunita mentioned there's a lot you don't know, but even sharing the process that we're going through of what we're thinking about, the strategy.
We may have lost.
Town hall.
Hi, Mike, can
Did
you
you
try
lose me?
repeating that again? Yeah, we lost you for about the last 10 seconds.
It's about transparency, and whether it's verbal communication, or town halls, virtual town halls using people participate in the thinking process of should we do. It's not just about leaders thinking it through, but getting the whole team involved and that transparency. So in 2001, we had a business crisis. We shared all the negative situation of the business and what we're thinking about. What we recommended to the current company is the cash flow crisis that Virgin Orbit's going through. Share the cash flow information, what we're doing about it, what we're trying to do to raise cash, and keep people informed. So the more they're informed, the more they're aware, the less anxiety they have, because you can't make promises about their job, their future, because we're all uncertain about it. But keeping them involved in the process was really unique, and we did it several times through my career, and the company that I'm on the board of, we're doing it as well.
Thank you, Mike. Sunita, would you like to just add to different strategies to improve to boost employee morale?
Yeah, a lot of what both Amy and Michael said. In addition to that, we're really helping our employees reprioritize their work. So the goals they had in January aren't the same goals they're going to have throughout this crisis. We changed all of what I would call process and policies. So we had a pretty detailed performance appraisal review. We cut it to one page. We only dealt with competencies. We took a lot of the mandatory required training and kind of reprioritized all of that. We're offering virtual programs with tips, daily tips on how to work from home and how to connect with others. We're encouraging connecting with people. We're encouraging taking time off and vacation. We lead every conversation with a health and safety conversation, that's the most important thing. And we did a good hot wash, new word for me, and got really good feedback that our employees really feel great about the way we have put their needs ahead of some of what traditionally we've done.
I'm going to stay on the questions that are coming in from our audience, because they're taking a very interesting take on what everybody's talking about. And I think you'll be able to add a lot of insight to what people are thinking about out there. So one is, for non-essential workers, when employees are designated as non-essential workers, and maybe Sunita will stay with you on this. When employees are designated as non-essential workers, how do you then raise their status when they return to work? Especially because there's been a number of the colleagues that may have been let go. And then we'll maybe move that to either Amy or Mike, if you would like to add anything to that.
I hope I'm interpreting this question correctly. In our organization, our CEO is working from home and is a non-essential. So that's the way we're raising everyone's status. We're saying you're not essential to be in the workplace, meaning we care about your health and safety, and we don't want you to compromise that. You can do your job from anywhere. Not that you're not essential to the business and to the importance of the work that you do to help the business grow and be productive. So that part, everyone is very essential. That's the way I would answer that question.
Okay, good. So Amy, I don't know if this would apply to you as well. Are there non-essential workers that, as you incorporate them back into the workplace, how do you kind of reintegrate them and keep them motivated and have them as a productive employee?
Sure, I answer it a little bit differently, Ed, if you give me some opportunity to do that. First of all, we needed bodies. We needed people to come and work in the hospital. And there are folks who were within the organization who's like, look, I'm in IT. I can't deal with, dying people and all of I don't have any skill set. And we were desperate for people to pass trays and do all of the work that has to be done, especially as people got sick and staff got sick. So we were asking people, we set up in essence a staffing agency internally and said, look, these are the type of skills we need. If you want to be able to do, and we did it, sort of a manual process, but ultimately that is one of the big takeaways from that is really setting up a job board that says, look, this is what we need. So if you would come in and do it, we will pay you. We will make this happen. We took people who may have been seen as not essential, meaning the folks in our outpatient, and we said, you have to go back to work. So we took anesthesiologists out back to work in an inpatient setting. So we took anesthesiologists, who were used to doing outpatient work as, part of a surgery center, and they came right back in and, were part of a team. And they may not have been that leadership captain role that they used to play, but they became a team member because we needed all hands on deck. So, from that perspective, that was a skill set change. That was an adjustment. And some people said no. And, we had to make a decision about whether that was okay. And so, that has been, I'll tell you that has been a dynamic within the workforce of the people who went out on leave because they had underlying conditions that they could not be in the hospital, having them re-enter and having to work through that tension that exists from, those folks who said, look, I was in the front line, you weren't here, and trying to make sure people understand the value that we all add. And that, again, just requires hand-to-hand, being out there, identifying the issues, putting them on the table, and creating opportunities for teams to have safe zones to talk about those things. We're on the same high reliability journey that I know everybody else is as we look to go to zero harm. And at the core of that is conversation that needs to be had to ensure the most appropriate teamwork. And a lot of these things go to the heart of that. And at the end of the day, we are going to have to make difficult decisions in the hospital industry. We are not seeing our volume come back. I have some notes to talk about that later, but patients are very cautious about whether or not they can come back in or even trust to come back in. And so our around that and really gaining patient feedback as well to make sure that we're addressing their areas of concern. But at the end of the day, everybody is seeing a significant loss in volume and the hospital industry is going to have to restructure.
Very, very, very interesting because there's a couple of questions here on the business side as well. And what I'd like to do is maybe direct this question towards Mike. The question is, what changes did you make to your business plan because of what was happening in the economy and the geopolitical space? So it may be in that 2008 period or any point to your career. The really question is what changes did you make and what were some of the influences that went into that?
Well, let me pick on the time from 2001 where the business models that we were working under, where we were building a rocket over my shoulder at the Atlas, the business environment cratered. And there's a lot of parallels of what's going on right now. Investment capital dried up, the market dried up, and we just saw a big downturn coming. And we were in competition. Our main competition was Boeing, basically in the same position. And we worked to form a joint venture. And that's where United Launch Alliance came about. We really had to restructure the whole marketplace in response to the environment that we're in. Bringing the parallels to today, you set the stage for a crisis in your everyday work. We were just talking about the term of non-essential employees. When I was the leader of the business, as the CEO or the president of the business, I always said I worked for the person turning the wrenches, building the hardware, launching the rocket, testing the rocket, because they were the value-added task, and the rest of us were support, not essential, but support to those people. And so just like Sunita said, it may not be essential to be coming into the facility, but you're still essential to the business, and we may need to find you different roles. But that's a continuum in leadership that you need to really talk about so that you're prepared when a crisis comes about, that you value everybody on your team, and you find ways to utilize them in new ways. Some cases you can't find a task for everybody, and that's when the layoffs or furloughs come about, but you treat them with respect and dignity, and mostly just keeping them apprised of the situation.
Thank you, Mike. There's another question, and Amy touched on it when, I think it was Amy, you mentioned about forcing people to take time off, I think was your comment. And I think that's really was around really trying to manage burnout and making sure people did not overwork themselves and deal with that kind of problem. And so the question that's coming up, or that came up, I'd like to point towards Sunita's way, and then maybe direct it back towards you, Amy, if you have more to add to it. The question is, data shows that behavioral health is on the rise during this crisis. How are you handling this and making adjustments to create a healthy workforce?
Yeah, that's the biggest concern. It's more the mental health, right? The mental health of people. I think Amy mentioned isolation. That's not the way we're used to working. And also having to work, take care of your children, take care of your elderly parents, all in your house all at once, and not being able to go do anything. That's a lot of burden on employees. So the way we're dealing with it is, one, as I said, we're opening up every conversation talking about health and talking about people really needing to take the time to address their mental health and the people they care for, and to continue to do that, and giving them the time and resources to do it through our healthcare provider and EAP and all other types of resources, and telehealth and everything else that was mentioned. The other thing we're doing is we're acknowledging, I think this is really important, that we're acknowledging that this isn't just happening to some people, it's happening to everyone, and that each one of us, and this is all the leaders in our organization, is saying, yeah, there are times I've felt like this, and it does not feel good, and here's what I've done. Today I connected with 2 people, or yesterday I had a video chat with an old friend. We're trying to put it in practical ways so employees understand it's not just happening to them or a few people, it's happening to all of us, and we're coming up with tips and ideas on how to cope with it better. But again, it's all in the acknowledging that it's happening, and that it's happening to everybody, and then providing the resources and support to take care of it.
Thank you. Amy, do you want to add anything to that?
Yeah, Ed, I hope you don't mind if I'm direct, but the reality is that the Employee Assistance Program folks will tell us, until their direct supervisor, for healthcare workers at least, I can't speak beyond that, until their direct supervisor gives them permission by saying, I've done this and this is what it did for me, they will not get help. It doesn't matter how desperate they are. It doesn't matter how in need they are. None of it matters. At the end of the day, they do not want to fail their immediate leader. All of us in the big ivory towers, they don't really care what we say anyway. They don't listen to us most of the time. It's that direct line leader, one-on-one, saying to them, I am worried about you. I know you're carrying your mom, your sister, whatever. Your brother's out of work and they've moved into your house. You've told me that. You need to make sure that you're taking care of yourself. And here's the number. I want you to call. I'm going to check in with you because I'm that worried about you. Now, that is a level of intimacy from an HR perspective that managers, they're really good at making sure you got your schedule in and doing your rounds and doing all those other things. But this conversation requires another level of skill that we are really working hard on making sure our leaders have, because honestly, we are not going to be able to support people through this pandemic, which I think is going to go on years, unless we are involved and engaged with them in that way. They will not stay for people who do not appreciate what's going on in their own life as well as what they're giving at work. And staff are so worried about failing their leader and looking weak. And so it is, we have been very, I've done Every senior team has gotten the in-depth exposure to what these programs are, how they need to talk to about it. We are now putting up examples of people who have volunteered to step up and done videos, our doctors, our nurses, and said, look, I've used this program. This is what it's done for me, trying to provide those same things that you do in the media by giving people the examples that they will see themselves in that. We have been very proactive in our leadership rounds and making sure that the EAP is a constant in those rounds. Do you know about it? Are you taking advantage of it? And then, the telehealth phenomenon, I do have to make a little fun of my colleagues who in the physician community told me they could never do telehealth, and it was absolutely no way possible that they could connect with their patients in that way. And then all of a sudden, overnight, we were able to set these things up, and it's now 40 to 50% of our business. And I think that, while people say we're concerned about the reimbursement and whether it'll stay, it doesn't matter. The consumer is not going back to sitting in an office waiting for that. This has now happened. And so we are going to have to figure it out. And so all of this is great progress, is very exciting from consumers' perspective, and completely unnerving to the physician and nurse and therapist, who is now using an entirely different medium. I mean, look, I'm a social worker by trade, right? I watch people's cues. I watch them out with their eyes. I can see the tick if they're telling me a lie to tell me what they want to hear. Like, those are things you learn. You can't do that anymore in the same way. And now, not only the same way, now you're doing it through chat box, or you're doing it through a text message, depending on what the consumer wants. And so it's a whole new brave world, but all of those things are positive for the consumer, and healthcare will have to adapt because somebody else will come do it if we don't figure it out.
That's great. That's a great answer, because you took us to the wrap up. Unknowingly, where I wanted to finish was really talking about change and agility and some things that companies might do going forward that they wouldn't have thought about in the past. And so telehealth is a great example of that. And so this is really, as we wrap up, thinking about sort of the silver lining. And as difficult as each crisis has been that we have gone through, there's always been sort of a silver lining or something positive that has come out of it. And so I just, a minute or less to each of the panelists, kind of wrap up with a very positive note. Maybe you could think through what you think one of the silver linings are that you're taking away from this, or that you experienced in one of the past crises that you can share with the audience. And then I'll turn it over to Lubna. So I'll start with Mike, and then we'll work over to Sunita and back to Amy.
Yeah, I think Sunita and Amy talked about the silver lining that I'm seeing being a board member for a company is the ability to work from home, the flexibility and the productivity that's coming. We're actually seeing higher productivity from people working at home. There's an element of cohesion that's been a challenge, but people are really dedicated to the company. They're dedicated to the task at hand and getting it done and finding ways to manage that home-life balance. The lesson learned also is making sure people take time off. I had to coach our CEO. She's a wonderful leader. She's got a lot of crises on her hand. But I had to say, you got to set the example. You have a boat. You take some time off, go out, enjoy your boat, and then post some pictures on Facebook to show that you're doing it, so that everybody sees it at the company. So the opportunity set is the silver lining is, we're going to learn how to work differently through this, and people are much more flexible and capable. In every crisis I've been through, or every change I've been through, it's the spirit of the people and their capability as a leader. Don't underestimate them. Ask them to stretch, ask them to do something different, enable them, and they'll figure out a way to make it happen. But don't underestimate your team.
Great answer. Sunita?
Yeah, so everything Michael said, I agree with. What I would add to that is what this working at home has done. There's a silver lining for both companies and employees. For companies, they don't need the infrastructure and all the bricks and mortar that they've had. So all that cost that they took on their books, they can get rid of. So we're reimagining our entire workplace now, and we're doing it faster than we would have ever done had this been under normal circumstances. And because we now know you can work from home. We never knew that. Just like the telehealth, we kept being told, no, you can't have that person work from home, not that job, not that department. Well, guess what? They're all doing it. So that's the silver lining for companies as they think about how work can be done. The silver lining for employees is they can work anywhere. You can be sitting on a mountain in Colorado and be working. So that is for this new generation of employees, that's very encouraging. They can incorporate their personal life and their work life together. And for some people, they can work any hours they want to work, right? So that just frees people up to spend more time being who they want to be versus living within the parameters a company gives them. That's a huge silver lining.
Thanks, Anita. And I like the Colorado reference. That's for you, Mike. And Amy, you want to wrap this up with your last comments?
Sure. I would echo everything that Mike and Sunita has said, so I won't be. I would say that three things that come to my mind. One of which I should have spoken of earlier in the session. The support that we receive from our communities, just average people coming forward, giving food, making sure our staff were supported, was just overwhelming. And I really can't tell you what it meant to our staff people to know how much people were pulling for them. And it was critical. And I cannot overstate how thankful and grateful we are for that. We've always had great community partners, but they would come and do parades for us, and staff, when they couldn't find a moment of success or hope in their day, the community really provided that. Secondly, the transparency in which we delivered messages. We would spend weeks going through memos, making sure they said the right things. We didn't have choice. They were out there every day. Boom. Okay, you said stuff wrong. You spelled it wrong. Get it out there because they need it on the floor. And I think that is going to continue. That level of transparency is something that I think people got comfortable with very quickly, and that the staff are going to demand going forward. And I would say that that the level of engagement in the lives of staff is critical. Making sure we understand what's going on in their personal lives. As Sunita talked about, this whole pressure, and look, it's nobody's fault. Everybody's doing the best we can, but not knowing whether schools will be open or not. For all of our parents who are dealing with having to support their kids after working 3/12s, that's 3 days a week, 12-hour shifts, and then coming home and doing another, whole school day. Is really hard. And for some of us, we didn't do that well in the geometry in the first place, let alone having to do it now with our kids. So, that's a real challenge. Secondly, really making sure that we understand what's out there within the communities. There are school districts who have provided tutoring for children, and really making sure that we understand those things so we can connect that. But also, I don't want to miss what Mike said. Leaders who walk around and talk about the importance of taking time off, they're watching you. If you're not taking time off, they're not doing it. And so you can't just say it, you actually have to live it. You got to go get help if you're struggling. You got to talk about it and be vulnerable. And last and most importantly, you need to walk the walk and talk the talk, or people are not going to see you as authentic. And let me tell you, right now, more than ever, you better be an authentic leader or people are not staying with you.
Great message. Great finishing message. Thank you very much, Amy. Lumna, I'd like to turn it over to you to wrap up the panel, and I'd like to thank the panelists as well before I turn it over to you. It was a great discussion and great questions from the audience. Lumna, you're on mute.
Oh, here we go. Can you hear me now?
Yes.
Yes.
Wonderful.
Ed, this was a fantastic discussion. Thank you so much all for being here with us. Ed, did you want to say a word on CBS or?
Sure. Yes. Yeah. I'll finish up on CBS and then turn it over to you to finish up about Rutgers. Yes. So as everyone's aware, we co-hosted this panel. My firm, Competitive Business Solution, is so happy to be working with Rutgers on these discussions, and I hope you found this interesting and gained some insight. I certainly did, and enjoyed it immensely. Our firm focuses in on operational excellence, supply chain management. We support private equity firms in due diligence and acquisition. We support program project management, and as we discussed much of today, around leadership and change management. And our firm is very much dedicated in helping COVID-19 and the support going forward. So it's been a great hour. So let me turn it back over to you, Lubna.
Thank you. Thank you. Okay, let's see. All right, here we go. Okay, thank you so much. So I just wanted to share with the participants that Rutgers School of Management and Labor Relations offers leadership certificate programs. We have one coming up in September 22nd to November 24th. It's structured as a 10 half-day online workshop. It's on Tuesdays from 9 to 12, and participants will receive 30 business recertification credit hours through HRCI. Some of the topics that are covered during this certificate program cover improving ability to execute strategy, implement change, building confidence through executive presence, building and leading high-performance teams, and fostering a culture of innovation. So this is just a snapshot of what's included. For more details, please feel free to go to our website, and I will put the link on the last slide. If you're interested in joining, please visit our website and make sure to register at your earliest convenience. We also have another certificate program that's being offered this September as well, from September 17th to November 19th. And this one is on HR for the fourth industrial revolution. Same structure as leadership program, 10 half-day online workshops on Thursdays, 9 to 12. And it also covers 30 business recertification credit hours through HRCI, as well as 30 professional development credits through SHRM. And also for people who are interested in doing a master's in human resource management, they can get a waiver, a 3-credit elective course waiver. And some of the topics that we cover include aligning business and HR strategy, implementing change in your organization, leveraging talent analytics and artificial intelligence. And we have made sure to include a topic that examines the issues of diversity and inclusion through the lens of unconscious bias. And like I mentioned, you can visit our website here for more details. You can also visit CBS website here. So this ends our panel discussion. And again, a big thank you to our panelists, Michael, Amy, and Sunita. And thank you so much, Ed, and to your team for all the support. And have an amazing day, everybody.
Thank you.
Thank you.